All right, welcome back, ladies, to our next week for Science for Healthcare Workers. This is part 2 of our medical terminology unit, where we're looking at all these prefixes and suffixes and root words. So when we come across the new medical term, we can start breaking it apart to have a better understanding of what this word means. And so let's review what we covered last week. Here are different organs in our body. What organs do we see? Which ones do we remember?
Gastro is the stomach.
Correct. Gastro is our stomach. Very good.
Bladder.
Ooh,
Is that
no, bladder is not one of them.
cholestasis?
Yes, the cholecysto, but it's not bladder. There's a part there, you're missing a part to it.
Gallbladder?
The gallbladder, which is different than your bladder, right? Your bladder is that sac that holds all of the urine. Your gallbladder is actually an organ that produces that bile that helps break down food during digestion. And this is
We were just through that.
we were just talking about it. What color does this mean in Latin?
Green.
Green, exactly. So when we see this, we know it means green.
Is this
All right.
pancreas though? Is pancreas?
Yes, pancreato is pancreas. Some of them look very similar to the actual word we use. Like these two here look really similar to the actual word. Spleen, very good.
And adrenal is adrenal gland.
The adrenal gland, very good. Now the H one is a little bit harder. Hepato, like hepatitis.
Blood?
Not blood. Blood does start with an H. Blood is hema, like hemoglobin. It's one of our organs. Think about which organ we haven't talked about yet.
Liver.
The liver, very good. What are you doing here? Very good. It is the liver. All right, so we had our stomach, our gallbladder, our liver, spleen, pancreas, and adrenal gland. And again, these ladies, this is just a tool for you to review that if you ever want to go back, you can go through these slides and you have a good list of all of these medical root words that we link together. So there's our organs. Next, we have the body. We're looking at muscles and bones. What do we got?
Brachii is arm.
Yes, brachii is arm.
Myelo is bone marrow, right?
Yes, so this was one we talked about at the very end. And I think it was you, Eva, that brought up the term you wanted to look at, myelofibrosis.
Yeah.
Yep. And we learned that we looked it up after class that malo is bone marrow, fiber is like scar tissue. And so myelofibrosis is this bone marrow being replaced with scar tissue.
Yeah.
So
that's interesting. And pet is it leg or feet?
Feet, not leg, but feet. Yes. So like a foot doctor, you'll see ped in there. Anything related to, pedicure, exactly. Yep.
Easy
pedicure.
to remember.
Yep. Manicure is with our hands, because if something's manual, we use our hands for it. So manicure is our hands, pedicure are our feet. I also think of the words like centipede and millipede. Centipede has all the different feet that they have.
Carpal is it wrist, hand, right?
Yes, wrist, very good. For like carpal tunnel, right? In our wrist. Got one more. Myo. I actually thought when we looked at this word, this was my original guess. I thought it was myo, which is muscle.
Okay.
This is muscle. So anything dealing with our muscles will have that root word connected to it. And there are a few other ones, right? We had osteo for bones, like osteoporosis, our ribs, our scapula for our shoulder. All right, next, moving to our cardiovascular system. What do we remember?
Heme is blood.
Yes, heme is blood.
Cardi is heart.
Yes, we got heart.
Angie is blood vessels.
Yes, blood vessels. Yep. hmm
And the last one is veins.
Veins, very good. And this makes me think of the like phlebotomist as a type of I don't want to say the word doctor because they're not doctors, but and they're not nurses either. What is a phlebotomist? But trying to think of
They're
their
the one
official
who
title,
taking
but
out the blood.
exactly, they're the ones that take the
Phlebotomy.
blood.
Yeah.
And that is actually a pretty good paying job. That is actually a profession a lot of people get into, that they will do the CNA training, they'll get trained in the CNA, and then you can go, and I think to be a trained phlebotomist, it's only like a semester or two of classes. So you take those classes and then you get trained to be the phlebotomist, and then you get into a very stable job that's a pretty high need. But the phlebotomists are the ones that are taking your blood, that do all of the blood testing and all of that. And because again, we take blood samples from the veins. Now let's remember we have veins and we have arteries. Which color is which?
Oh, the red one is the one goes into the heart, and the blue one is the one who goes out. And this,
Okay. hmm
Are
So
arteries blue and veins are red? No,
mm,
opposite.
opposite. So our veins are going to be blue and our arteries are going to be red, right? Red also means that there's that oxygen inside of it. That's why it's that red color. The oxygen, the blue has more carbon dioxide, the CO2. The arteries also move slower, right? That they're the ones going to all of the muscles. They're deeper, right? They're deeper in the tissue, a lot lower, going slower, allowing that oxygen and all those nutrients to soak into the body. The veins are up top, they're up higher, closer to the surface of the skin, and they're moving faster. They are getting all of that bad stuff out of the body as soon as possible. And that's why when we look at our veins, right, we actually see the blue because it's closest to the surface. It's on the surface of the muscles, and it allows things to move faster, to get to the heart, to get pumped to the lungs, and then to get everything out of the body.
So they're actually blue. It's not just a label. Like, how interesting.
is it
Yes.
blue or is
Yeah,
it
yeah.
green?
Well, I think that's perspective, right? Like,
I know,
what
but
is,
whenever
yeah,
I
right?
read
Like,
on
is it
mine, it's
blue or
kind
is
of
it,
green.
yeah, right? It is kind of a greenish
Yes.
teal color. But then when they take the blood sample, the blood itself is red, right? So
Yeah.
yeah, it shows up. And so, yeah, I am not a phlebotomist by any means. Like I said, I just know the very basic levels that we're kind of scratching out there. But yeah, it actually is blue, and that's why we can kind of see that color. Those blue veins that we see throughout are the veins themselves. And that's where the phlebotomist is actually going to find one of those veins to take the blood sample. And if we think about it, that's also why they're doing the veins too, is because when they test it, they're testing all of the stuff leaving the body, right? So everything that's leaving the cells, everything that's leaving the muscles, so they're getting a really good sample of what's going on in the body, right? What are, what's all the toxins leaving the body? What's the bacteria, everything that we're trying to read is coming from the veins, what's leaving the body. Yep. And that's it. That's what we have for the cardiovascular system. There's more words like the aorta. We talked about the pulmonary, right? So that would be these ones here, right? The pulmonary artery is the red one here that's located in the heart, but it's going towards the lungs, right? The pulmonary. But this is one term I wanted to bring up. So when we were looking at Angie for blood vessels, it made me think of the word angina pectoralis. And I thought maybe angina pectoralis, this is one of our CNA terms, had to do with blood vessels. And I was wrong. I know what angina pectoralis is. Angina pectoralis is the pain someone has before a heart attack. So that tightness in the chest is angina pectoralis. It's the pain someone feels before a heart attack. And I looked these root words up, and what angina actually means, it comes from Latin, and it means to choke, that it's choking. And pectoralis is the chest muscles, so it's choking the chest muscles. That's that sharp pain that you feel, that shortness of breath before a heart attack, is angina pectoralis. That is on the list of vocabulary words under the circulatory system. I thought maybe it had to do with blood vessels, but it does not. Angina is a different root word meaning choking. So I mean, I guess the purpose of this is like sometimes they're misleading, right? Just like when we looked at the term for bone marrow, right? When I heard it, my brain instantly went, oh, it must have to do with muscles, because I didn't actually get the whole part of the root word. So sometimes root words can be misleading. We might think it's something else, but when we actually look it up in the dictionary, we find that it's a completely different root word. So like here, angina has nothing to do with those blood vessels themselves, even though it looks like it could have that root word. It's a different root word altogether. Does that make sense?
Yes.
Yeah, perfect. All right. Next one, we have other organs. This is our digestive system. Tell me about our digestive system. What do we got?
Appendix.
Yep, appendix. Anything dealing with the appendix, right? Appendicitis, appendectomy, all of those.
Colon.
Stomach,
Yeah.
Colonoscopy, colonectomy, all of those.
gastrostomach,
Gastro, so same thing. Gastritis, gastronomy. Those are kind of the easy ones. This one is easier than it thinks, but a lot of people miss it. So much easier than you think. It's one of those that when you hear it, you go,
Intestine.
oh, I knew that.
Intestine.
Intestines, exactly. There's another root word for intestines too, specifically the small intestines that's not on this list, and it is ilio.
Oh, Elio.
Yeah. So we'll see that is specifically the small intestines, right? On the inside, not the large intestines on the outside. What else we got? We got that. These ones are a little bit harder. What organs do we have left? One of them is this one right here. And the other ones aren't in this picture, but we have these little round ones on both sides towards our back.
Ren is kidney.
Kidney, very good. So we got kidney. Hepato.
Nep is the nothing. Nep isn't kidney.
Neph is also kidney.
Yeah.
So we have two words for kidney, and this is where it can get a little confusing too. Both of these mean kidney. There is a little bit of a difference. Do we know what the difference is between them? It has nothing to do with meaning. What is the difference?
Isn't it left and right? The other one is right.
Oh, that is a good guess, but nope. That has not. They both mean exactly the same thing. They both mean kidney, but they're from different languages. And that's where I was telling you English.
Okay.
English. Yep.
Okay. Nepro is come from Greek word.
Yes, it is a Greek root word. It comes from Greek, and we know because a lot of words with PH, that PH is a Greek letter, phi, and so a lot of PH things like graph, phone, photo, all those PHs is definitely a Greek root word, so we know that is Greek. What is Ren? If it's not Greek, what's our other family group? Latin.
Chinese.
Yep.
Chinese word. Oh.
Yep.
Chinese.
Latin. And this is where studying these root words, what we're doing can be confusing because we'll often have more than one based on which family that it comes from. And that's just the English language in general, right? That we borrow words from all these different languages. Even the history of the English language is this mixing of the
That is so true.
Anglo-Saxons. So we get French and Germanic words. That's why English has really unique vocabulary. Like we have the word stomach, but we also have the word gut. We have belly, we have tummy, right? And they all kind of mean the same thing, but they're coming from different family groups. But they also have different little bits of different meanings, right? Because of what family they come from. The word stomach comes from French originally, estomac, right? So it's very academic, right? It's the proper scientific word, stomach, where the word gut comes from the Germanic languages. And so that was kind of was what was called vulgar, or kind of like common, what the commoners or the common people used. So it's kind of this like more informal type of a word, gut, right? Got punched in the gut. And it even feels that way. It feels like a very informal word, gut, but they mean the same thing. Gut and stomach, same thing. And that's where we see this in English. We even see it in medical terminology. Sometimes we'll use Greek root words, sometimes we use Latin. When, I don't know if there's actually a specific rule. The only rule that I know that is if you're using Greek, you have to stick with Greek. If you're using Latin, you have to stick with Latin. You cannot mix Greek and Latin root words together, if that makes sense. So like geo is a Greek root word, right? So we can say, and graph is a Greek root word. So we can put those together. Geography, right? Geography, all of those are Greek root parts that we're putting together. You can't take Latin root parts and Greek root parts and mix them together. So like cardi is Latin. So you have to, you cannot mix the two together. And so we will see a few examples where you'll see both Greek and Latin root words and they mean the same thing. All right, so this was our digestive system, all the different terms. Next one is going to be our procedures, our tests and procedures that doctors do. This is probably, I feel, our hardest group of root words.
They're fun though.
They are fun, and
Yeah.
these really help us dissect those scientific words, right? It takes a really long word, and we can go, oh, I totally know what that means, because we can look at all those different parts. What are the meanings of these operations and procedures? What do we got?
So SCOPy is instrument for viewing.
Yes, scopy is where we're viewing, right? Where we're putting in a camera and we're looking around, right? Like scope. And we think of like telescope, right? Or microscope. Micro means small. Scope is we're viewing. So we're able to see something really small. Tele means to move, like to teleport, right? For like far distances. So telescope allows us to see really far distances. So seeing. What else do we get?
Stomy is an opening.
Stomy is an opening. Very good. Yep. So we've created an opening.
Otomy, is that like a hole, right? No, did I?
No.
Ectomy.
Ectomy is the removal of.
Is the removal. Yep. We've completely removed it from the body. It's the ectomy. Yep. So give me some scientific words where we've removed it from our body.
Colonoscopy.
Vasectomy.
Colonoscopy, they've removed a section of the colon.
Vasectomy.
Vasectomy, very good. That they, well, actually nowadays they really don't remove things. They kind of like snip it, tie it, and burn it and cauterize it. So,
Sew it up.
yeah, kind of. I don't know if that's necessarily removing, but they probably did. They probably removed parts back in the day, and so they still use the same term, vasectomy.
Hysterectomy.
Hysterectomy, yep, they're removing the uterus. Yep. Man, you ladies are keeping me on my toes. I'm like, wait, right? Is it the uterus? No. Yeah, it's the hysterectomy is the removal of the uterus.
Gram is image.
Yes.
Record.
Gram is image, yep, or recording, right? That we're writing something down, like the electrocardiogram was we were writing down the heart so you could really analyze the rhythm, the beats, and see if there's an irregularity. You know, is it too fast? Is it too slow? Is it pumping the way it should be? Mhm.
Isn't it graph is to draw or to write?
Yes, to draw or
Yeah.
write. Yep.
Yeah.
And in this case, I feel in medical terms, it's really relying on the word photograph where it's a
Uh-huh.
picture, right? That
Picture.
we're putting it on paper, right? We're looking at it.
Okay.
Like, so when I hear the word graph in most medical terms, I'm pretty sure it's to do with a picture, right? So
Yeah, the
one,
same one as the ultrasound.
yeah.
They
Mm-hmm.
take the pictures.
Mm-hmm. Yeah.
And then automy is cut
Automy.
into.
Yeah. Otomy is to cut into. Mm-hmm. Mm-hmm. And this is where I know looking at these two terms, we're looking at tracheotomy, right? That tracheotomy is the initial cutting that so someone is choking, there's some damage to the trachea where a person can't breathe. So in the ER, in the operating room, or the paramedics, like they might actually do an emergency tracheotomy where they'll actually cut a hole. They'll cut into the trachea to allow air in so the person can breathe. But then if they put a permanent hole that can with a valve, it would be a tracheostomy. And I thought these were the same things. And then last week when we really looked into it, we were like, oh, there is a difference between just an opening and an actual like permanent hole.
Like you're
That,
taking out a piece,
yep. Mm-hmm.
Tommy.
Mm-hmm. All right. Last things, we do have a few what are called pathologies of when we hear the word pathology is like a what do I want to say pathology means? It's like a type of illness, a disease, right? So when a doctor tells you what the problem is, when a doctor identifies a health problem, that is pathology, right? They're trying to figure out what is the problem. And so these are different types of problems that people can have. What do we got? And I
Itis?
realized some of my lines actually really aren't correct because like technically like osis, I should actually put the line at the beginning of it, right? Because osis will always happen at the end of a word. Itis will also always happen at the end of a word, but this will always happen at the beginning of a word. What do we got?
Itis is inflammation, right?
Yes, inflammation. It is swelling, getting up. We had appendicitis, gastritis, tonsillitis, arthritis. Arth is our joints, so arthritis is the swelling of our joints. Mhm. What about?
Emia is blood.
Yes, this has to do with blood. Mm-hmm. Mm-hmm. Like leukemia, different things. Blood. Mm-hmm.
I think OSIS is about increasing or abnormal process. OSIS like neurosis, metamorphosis.
Or
Mm-hmm.
like a process
Yeah,
of
a
Yes.
process.
Mm-hmm. And in medical terms, it just means condition or disease. So for example, like when we looked at the bone marrow turning into scar tissue, it ended in osis, right? We had the myelofibrosis, right? Maleo, bone marrow,
Yeah.
fibrosis. So the medical condition in which the bone marrow is turning into a fibrous tissue, like a scar tissue. And that's where those pieces get linked together. Osis is like disease or condition. So a lot of diseases like scoliosis, right? So the scolio, we're talking about the spinal cord, osis, the disease, the condition.
How about ketosis? I mean, that's like not a bad thing.
Ketosis.
Ketosis, when your body goes into it.
Yeah, yeah.
It's just a
Ketosis.
condition.
Yeah, just a condition. Yep. And honestly, when I look at our definition, condition is one of the options too. Like, right? It's just a condition or disease. All right. Or some of our other ones. We got the first two, and we got blood. This one here,
Penia is breathing.
breathing. Yep, like in pneumonia, right? That we see that root word for breathing for pneumonia. All right. And there's a bunch of other ones, rhea, like gonorrhea, diarrhea, that idea of excessive flow, different things. All right. And then just to review, we talked about these here too from last week. We talked about different sizes, micro, macro, and mega. We talked about numbers. There's a new number one that we're going to talk about today that we can add to that list. I'll give it to you now. It is hemi, which is different from hema. Hemi is going to be our Greek root word, and it is a quantity. It is a number, kind of. What do we know with hemi? Any guesses? A common word that you've heard of is hemisphere. We talk about the hemispheres of the Earth. We have the northern hemisphere and the southern hemisphere. So what could a hemi mean?
Old.
Oh, you say old? O-L-D?
Cold.
Oh, cold. That's an interesting guess, but nope, has nothing to do with cold. We're talking about it's going to be a quantity. It's going to be a number. Hemisphere. Hemi. And think about sphere. What does sphere mean? Sphere.
Round.
Yep. And like a ball. And if we talk about the Earth's hemispheres, and there's two of them, right? We have the northern and the southern. What are we counting?
Two.
Two. Yep. And it means half in this case.
Oh,
I spelled the word northern wrong. So if something is hemi, it is half, kind of like semi. So hemi is another one of our root words for half, our prefix. So we have sphere is a ball or a circle. The hemisphere is half of the sphere. So we have the northern half and the southern half, the northern hemisphere and the southern hemisphere. We'll see some medical terms with hemi meaning half. All right. We looked at functions and quality, so like good, bad. We'll look at some of these today too, especially the A and the dis and the anti. And then we have our hyper and hypo for above and below, which we see in blood pressure. What's high blood pressure? Blood pressure, pressure, tension, hyper. What's
Hypertension?
the tension? Very good. Below temperature, if someone's body temperature gets too cold.
hypothermia.
Hypothermia, we got it. Perfect. And then we had all of our time, right? Everything that was time oriented. Tachy meaning fast. Tachycardia, fast heartbeat. Bradycardia, slow heartbeat. All right, let's practice. What we're going to do is you need to connect two of these terms to make a medical term. We have our different parts of the body and we have different procedures. How could we connect them?
Appendicitis.
Very good. So we got appendicitis, colonoscopy. All right, let's talk about these. What is appendicitis?
Inflammation in the appendix.
Inflammation.
Yep. Inflammation of the appendix. Colonoscopy.
Colon is
Instrument for viewing.
Yep. And what are we viewing? What are we looking at? The colon itself. We're going in with a camera and they're taking a video of this beautiful canal, right? That was a joke. Most people dread going in for a colonoscopy. What age should people get colonoscopies? And should everyone get one? Why do people get
40,
one?
right? Men, especially.
Most, look for the most.
I don't know.
That's a good question. I'm not a doctor. I was under the impression that everyone should get colonoscopies because of like colon cancer and different things. That I
Yeah,
think
and
it's kind of that it's a common practice for both men and women doing colonoscopies for
mhm.
like colon cancer and different colon issues that can come up. But I thought the magic
I
number was
wonder. I wonder if
50.
it's. I wonder if it's more common in men, or is it just the impression I get?
Well, let me look. That's a
No,
good question.
sometimes it's also runs in hereditary, something like that.
Yeah.
So if you have history of you have someone have colon cancer sometime, and then you need to go under that colonoscopy so they can prevent or something like that. If you have history on the family,
All right. So I'm seeing, so I just Googled, searched, and it said, when should I get a colonoscopy? And now I'm sure I'm going to get all this like spam email now being like, you should sign up for your colonoscopy. And I'm like, no, I'm only 32. This says no matter what you should plan to get your first colon cancer screening at the age of 45 is what they're recommending. Yep. So 45.
oh,
And it says national recommendations advise men and women to start getting colonoscopies at the age of 50. So, yep, 50 was kind of the number. So 45 and 50. But yeah, and it's like, again, I'm seeing men and women. And then like what you were saying, Maurice, is especially if you have family history of colon
mhm,
rectal cancers, 10 years younger than the age that your relative was first diagnosed.
with
So
it.
if you have family members that were diagnosed with colon cancer, they recommend you take the age that it was found, subtract 10, and that's when you should really start taking precautions and getting colonoscopies and just looking around.
Sean, did you say you're just 32 years old?
I'm 32. I'm actually 31. My birthday is Thursday of next week, and I'll be turning
So
32.
you mean we're both 1990?
Yes, I was born in 89.
Oh, okay, Sean.
Yep.
Okay, we're not far
No.
away.
Yep. I was born March 24th, 1989, right? So I am 32, right?
Yeah,
Yeah, I'll be turning 32.
we're
Now,
turning.
once I turn 30, all the numbers just kind of blurred together. I'm like, wait, what? But yeah, I'm turning 32 here
Well,
next week.
happy birthday to all us
Oh,
in March.
yes, thank you. Are there other March birthdays here?
There's me. I was on the 14th.
On the 14th, congratulations, happy birthday.
Thank you.
And so, yeah. But luckily, I'm not turning 45 and I'm not turning 50, so I don't need to get a colonoscopy. I think because talking about the idea of like men should get it more than women, I think what we were looking at was like prostate cancer. But for prostate cancer and prostate checks, they don't actually do a colonoscopy for the prostate. The prostate exam is actually different. They don't go in with medical because the colon, right? You have to go way up in there. And so they are taking that microscope all the way up. For males over the age of 50, getting their prostate checked doesn't require instruments like a colonoscopy. It's a
I
pretty,
guess I've heard men, a couple men say that they were getting it, and I just kind of confused the two.
mhm. No, yeah, absolutely. But what I'm seeing is that men and women it's recommended for both. And I do know that colonoscopies are a pretty lengthy procedure, right? It's not just a quick check. It takes a long time because they have to prepare the instruments, they actually go in and take a recording. And I feel like it's good 15, 20 minutes. I don't know, I'd have to research it, but it's a pretty lengthy procedure and it's very specialized too. So I know people
Sounds
when they need to
scary.
schedule it, they might be waiting several months to get into the specialist to perform the colonoscopy.
It's not even that you have to well they put you to sleep and then the
Mm,
other thing is you have to start like 2 days ahead to clean out your colon and everything, basically not eat anything.
yeah.
Because I was there when my dad had the one and it's
Okay.
he can't eat anything for like a few days or there's
Mhm.
certain he can only have really light liquids and they give him this whole jar of things, something he has to drink to empty out his colon and stuff. It takes a few
Like,
days before the
Yeah.
appointment.
Absolutely. Yeah. So it's a pretty lengthy procedure. And when we talk about checking the prostate, that's a pretty quick and simple, like you don't need to be sedated. It's a pretty quick check for men over 50 to get prostates checked. All right. So that was colonoscopy. What else do we got? Let's link.
Gastritis.
Yeah, we have gastritis. What's gastritis?
Inflammation in stomach.
Yep, the stomach is inflamed. Yep, it's swelling up.
So cholecystomy.
Yep, we have cholecystomy.
So removal of the
All right, if we're removing it, we need the ecto part of it. So it's the
Okay.
cholecystectomy.
Oh, okay.
Cholecystectomy.
Yeah.
Oof, that is a mouthful. Because we need the cholecystectomy. Cholecystectomy. Oof. Let me type that in and get a professional to say it. I'm not a professional.
I'd like to hear it.
No, quiet. Stop it.
Right.
Okay.
Pronunciation. All right. Are we ready, ladies? Let me make sure my volume is being shared.
Cholecystectomy.
Cholecystectomy. Cholecystectomy. Yeah, because we have the cholecysto, so cholecystectomy. Cholecystectomy.
Cholecystectomy.
And here's the pronunciation that I'm seeing here. So I just went to Google and just typed in cholecystectomy pronunciation, and this comes up. Cholecystectomy. All right, what else do we got?
Could you have esophagitis?
Say it one more time.
Like the esophagitis? Esophagus?
Yeah, esophagitis. Yep, that would be the inflammation of the esophagus. Esophagitis. We can actually have an itis of all these things, right? We could technically connect itis to all of them, right?
Pancreatitis.
Yeah, pancreatitis. Ileitis would be the inflammation. And that's the way these roots work, is that once you have it, you can connect it to pretty much any of them. As long as you're sticking with those, like what I was saying with the Greek to Greek, as long as you're using a Greek term, you can connect it to another Greek term. And that's why sometimes our body parts, we will have both the Greek and the Latin based on what roots we're wanting to add to it. We'll use the Latin one with other Latin terms, and we'll use the Greek one with other Greek terms. All right, what else do we got? All right, what we're gonna do now is we're gonna play a game where someone will describe what it is and you have to make a link to the two of them. For example, what is the removal of the stomach?
Gastrectomy.
Yes, gastrectomy. Gastrectomy would be that there. All right. What would be the removal of the pancreas?
Pancreectomy.
Pancreectomy. Very good. Yep. So we have pancreas and we have ectomy. What would be cutting a hole, putting a hole into the colon.
Oh,
The col colotomy.
colonotomy or
Yeah.
a colon?
Yeah, I think it would be a colonotomy.
Yeah,
Yeah,
colonotomy.
well, you're actually gonna add the on for colon part of it.
Mhm.
Colonotomy. Yep. All right. Perfect. All right, so let's move on to some new words. That was practice from last week. Here are some new words that we might know, we might not know, but we're going to break some of them apart here. I think I have 3 pages of new words. So, first word, atrophy. This is a medical term that we hear. What does that mean if you hear someone has atrophy? What is atrophy? Have we heard that term before? Atrophy?
I have not.
We've not heard it?
Nope.
Atrophy.
I have, but I can't remember.
So atrophy
The
is,
Lancy.
go ahead, Maurice.
Oh, sorry. Yeah, go ahead.
So atrophy is when someone loses, so their muscle mass, their muscles become weaker and weaker because they're not moving them. This happens when someone has a surgery or an operation. Maybe they're put in a cast, or they're sitting in a bed for a long period of time. Sometimes someone might be in a coma, right? Or they're in a coma for 3 or 4 weeks. They will start to experience atrophy, where their muscles are not working properly. And I think that's where the A comes in to atrophy, where that's like it's not working properly. But atrophy is one of our terms where it means the muscles are becoming weak because they're not being used.
Mm-hmm. One of the example for that, Sean, is when you have a half stroke, like one of your body into a half stroke, so your other arms isn't working. It's much smaller than the one who used to work.
Yeah, exactly. Yep. hmm And then the muscles get smaller themselves too. You often see it for like individuals that maybe they get into like a car accident and they become paralyzed from the waist down and they're in a wheelchair. Their muscles and their legs will start to get really, really, really small, or what's called atrophy, and their legs will get really thin because those muscles aren't being used. They're not strengthening those muscles. All
Oh,
right,
is that why we have the mermaid look? Kind of, right?
yeah, yeah, that the legs
Okay,
can
that
get
makes
super,
sense.
super thin, and that's all atrophy. All right, the next ones have to kind of deal with that. What is quadriplegia, or someone is a
Quad
quadriplegic?
quad is kind of like four.
Yep, 4.
So,
Yep.
so you're
Quadriplegia
paralyzed.
is the paralysis of 4 limbs.
Yes, there's a paralysis of all 4 limbs. Very good. So they are in a wheelchair and they can't really move their upper body or their lower body. What about a paraplegic or paraplegia? Pair?
2.
2. This is like both legs don't work or both arms.
Paralysis of the lower limbs
Yep,
and body.
paralysis of the lower limbs. Very good. And then hemi. This does not do with blood. That would be hemo or hema. Hemi, like hemisphere. What does that
Half,
mean?
half, half
And
of
that's
the limb.
more, and hem is more this way, up and down, right? So we're looking at the right side of the body or the left side of the body. And this is often linked to stroke. We talked about that when we were looking at the circulatory system, that because our brain is contralateral, that if we have a stroke in one part of our brain, the other part of the body will get affected. And that'll be a form of hemiplegia, where half of the body becomes paralyzed, but it's not the top bottom, it's the left or right half, like hemisphere. All right, so those are all about paralysis or paralyzing. Let's look at the word antibiotic. What are antibiotics?
Opposite.
So I see anti, which means opposite. What else do we see?
Is bio like life, right?
Bio is life. Yep.
So it
Opposites.
kills, right?
Yes, it kills life. Exactly. Because what are antibiotics used for? What are we
Infection.
attacking? Infections. And what are causing infections?
Bacteria.
Bacteria, other living organisms, right? So other living organisms, other bacteria, these single cell bacteria, because viruses, antibiotics are not used for viruses. Are viruses living organisms?
No.
No, and that's a debate. It's a debatable topic. I was taught in science classes that viruses are not living organisms because the definition of a living organism means it has the ability to procreate, right? It has the ability to beget, right? That two humans can get together and beget a child, right? That living organisms have that reproduction. Viruses are not able to reproduce. Viruses need another host for the process of reproduction, right? That virus attaches to another cell, it drops its DNA code into that cell, and then that cell copies all of that DNA and forms copies of the virus that then kills the cell and spreads out. And they do it over and over again. A virus is not a living organism. And that's why antibiotics are used for living organisms like bacteria. Bacteria is a living organism. If bacteria is put in an environment that has everything life needs, water, food, a good temperature, right? If it's a moist, warm area, if you take a piece of bread and put it in a warm, moist area with a limited amount of light, what's going to happen to that piece of bread?
It starts molding.
It starts molding. Exactly. So that mold is a form of a living organism, right? Because it reproduces and they get more. You start getting a colony, right? A colony of bacteria where one makes more, which makes more, which makes more. And they start making like this little bacteria village, and there's like highway systems, right? That's the way I think of it. And then those bacteria then can pass from living organism to living organism. So antibiotics is it's going against those living organisms. And so anti meaning against, opposite of life, antibiotics. All right, let's break up this word. Microorganisms.
Micro is small
Yep, micro is small.
organism.
Organ.
Small.
Organ.
Organ is,
Part.
oh, yeah. So like a heart is a type of an organ, but what is an organism?
Yeah.
The word organ itself is a root word similar to bio, meaning life. If something is organic, if something is organic, it has life, right? It's original. So an organism is an alive creature, right? It's alive. It has life. It's an organism. And so a microorganism, small living creature. And so bacteria and bacterial infections are all microorganisms, right? They are living, like animal. They're not an animal though. Can't use the word animal. That's why we use the word organism, right? They are alive. They have cells. They have nucleus. They reproduce sexually, right? That they go through. I shouldn't say they reproduce sexually. They reproduce through mitosis and meiosis. That they reproduce that way, but they are these small single cell organisms. All right, more new words. First one here. This was one of our CNA terms here. Alopecia, and that is the hair loss, the condition of losing hair. It's more common among males than women. I am suffering from this condition, and I'm only 32. But yeah, alopecia, like the loss of hair that we see. And so again, so I'm assuming
hair? Where's hair in that word?
that's what I was trying to find too. I didn't actually get into it far enough to really find it, but I'm assuming it has to, like this has to be the root word for hair, and a would be the loss of it. I tried finding because I know like pelo is hair in Latin, like Spanish, right? So pelo is hair in Latin. I don't know what the Greek word for hair is. Well, let me Google it. What is the Greek word for hair? Greek word for hair. Nope. The Greek word for hair is tricks. Yeah. Oh, might have found it. Maybe not. Trica, no. Mm-mm. So I don't know. I would have to investigate this more and look into the history of it. But the A is definitely the loss. And then somewhere in here, we're getting that idea of hair, that hair loss. But that's the scientific word for balding or hair loss. All right, the next one here, these two are easier than they look. We have dis. This was one of our root words. What does dis mean? Remember dis. Dis was one of our prefixes. What is dis? Do we remember? What is dis?
Not working correctly.
Not working correctly. So that gives us a hint already. What could this word possibly mean? We have dis, not working. Urea. What does that mean? What could that be? Yes, like urine, exactly. Urinary, so it means pee, right? So dysuria, what would that mean?
Not working properly.
What's not working properly?
Urinary tract.
The urinary tract. Very good. So
Yeah.
urination. So dysuria means the individual can't pee, right? There's something wrong with all of the exports from their body, right? That they're not peeing normally, or not a lot of pee. If someone has dysuria, they're not peeing that often. Maybe they're holding in a lot of the liquids. There's something going on. Now we have polyuria. What do we got here?
Poly means a lot.
Yes, poly means many, more than one, right? So a
Mhm.
lot, urea.
Urine, which is urinary.
Yes, that they're urinating a lot, more than what was normal. And interesting enough, this is actually a warning sign in young children for a very common illness and disease. This is one of the first warning signs of like, ooh, there might be a problem here. Do we know what problem? Really young kids that they're starting to develop an issue. It's kind of related to our digestive system a little bit, but one of the warning signs is excessive urination, the polyuria, and also like always feeling thirsty. Like, man, I'm always thirsty. And they're just drinking water, and they're peeing and they're peeing and they're peeing. Diabetes, exactly. That is one of the warning signs of young children, that doctors will ask that if they see a child that's just like always thirsty and saying they're always thirsty and just urinating, there's a problem with, and that's their way, their body's way of trying to balance itself, because the blood sugar level is too high and the pancreas is not working properly to decrease that blood sugar, and so the body's just trying to get it out of the system as quickly as possible. So they're just urinating, and they're constantly feeling like they're thirsty and dehydrated, because they are dehydrated. Their body is just getting it out of the system as quickly as possible. And that's a warning sign of juvenile diabetes. All right. Next one, what do we got here? Again, this looks really complicated, but once we start breaking it apart, we can kind of see what we got. We have our A, and then
loss, right?
All right, so A meaning no, or the opposite. Febrile. What does febrile look like? know. Any guesses? Febrile. Any guesses? Anyone want to take a stab at it? Get the scalpel and start poking around. Afebrile. Any guesses?
It's kind of fever or temperature.
Yes, you got it. Good work. It means fever. That's a scientific word
Uh-huh.
for a fever. So a febrile is a fever. And if someone is afebrile, what does that mean?
No fever.
No fever. They don't have a fever. Yep. So that's kind of one of the, because they might be looking for a certain medical condition, for example, with like the coronavirus, right? One of the warning signs is having a fever. And so they're checking patients and they're checking every patient's temperature. And so they would label patients as, nope, this individual is afebrile. They do not have a fever. All right. Aphasia. Phasia is one of our words. Phasia means communication and talking, kind of like
Speech.
language based speech, right? And so aphasia means they're having difficulties talking or communicating. And this is often a condition that is a result from what's called a TBI, a traumatic brain injury. A TBI, or a traumatic brain injury, that if someone has either like a concussion or they hit their head or they have a stroke that cuts off blood flow to a certain part of the brain, it then affects the way that they communicate. And there's different types of aphasias. There are many different ones. There's ones where people like lose language altogether and they feel like they don't have words. They don't understand words. Sometimes they understand what they're hearing, but they're not able to produce. Sometimes they talk and to them they sound intelligible and they understand what they're saying, but to other people it just is this mixed garbage of we have no idea what they're saying. But to them they get really frustrated because their brain, it makes sense inside their brain. There's several different types of aphasia that's really fascinating to study, but it's a disorder with communication because of a brain injury. Aphasia. What about this one? Dysrhythmia. Again, big word, looks complicated. What can we break up?
This.
Yep. We have dys. I see rhythmia. What do we got? What's dys, I mean, again?
Too
Not
much.
working properly.
Yeah, not working.
Okay.
What is rhythm? What could that potentially be?
Like a pulse or I
Yes,
don't know.
the pulse, right? The heartbeat, the rhythm of the heartbeat. So if someone has a dysrhythmia, it is an irregular heart rate. And the next word means the same thing. Arrhythmia is an irregular heart rate. That there's something wrong with their heart rate. It may not necessarily be the speed, right? Because that would be tachycardia and brachycardia, the tachy quick and brady slow. Dysrhythmia is actually the rhythm itself, because our heart has there's those four chambers of the heart that are split into two. The top squeeze first and then the bottom squeezes, so it goes that boom 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 boom. That's why we get that heart rate, right? It's the two parts of the heart, but because of if certain valves are not working properly or certain stress of the heart, that rhythm itself will be off. And that's what they're actually looking at here, is the rhythm of that boom, the space between the two bumps. All right. More words.
What's the difference between the two?
I think they're the same thing. There might be a difference, but I think they literally mean the same thing. Dysrhythmia or arrhythmia, it just means an irregular heart rate. Heartbeat. I don't necessarily want to say rate, because rate is like fast and slow. It has nothing to do with the speed of it, but rather the actual rhythm of the heartbeat. But I'm pretty sure these two mean exactly the same thing. We can ask a heart doctor. A heart doctor may use these terms a little bit differently, but to my knowledge, they're the same thing. It's just an irregular rhythm. All right, next one. This is my last slide of new words. These look hard, but they all have something in common. What do they have in common?
Urea.
Yes, urinary, right? So we're talking about the urinary. So it'd be a urostomy.
Cutting into the urine.
And where do we store all of our urine?
In the bladder.
Exactly. So this would be operating and cutting a hole into the bladder itself, a urostomy. Okay, an oliguria. This word olig, and I couldn't really find the meaning of it, but people were saying I couldn't find the origins of it, but what it means is small amount, right? So olig is a small amount. So an oliguria, what would that be? A small amount.
Small bladder.
Yes, a small amount of urine. And so again, they're not urinating a lot, right? It's a small amount. And then a pyuria, PY is a word that's used for pus, which is often a sign of an infection. So a pyuria is pus in the urine, meaning that there's some type of a bladder infection or a urinary tract infection. So these all have to do with the urine, and we can see that root word here. So that helps us when we learn it, we go, oh, that makes sense. PY means pus, urea is urine. So now I'm going to learn this word, and it helps me make those connections to hold on to it later. Because when you ladies go through the CNA training or the nursing training, they will just throw new words at you all the time, expecting you to start making those connections and knowing, all right, I at least know it has to do with urine because I see the urea part of it. I now need to just remember what olig means and be like, all right, that's right. Olig means small amount. So oliguria, small amount of urine. All right. Let's, yeah. What about this one? These actually all have to do with urine. I should have kept going, right? Urea, and urethus. Let's look at the next one. We should know both of these words. What do we got?
Hema, is that like blood?
Yes, hemo's blood, like hemoglobin, right? So we have hemo, which is blood, hema, and then urea.
Blood and urine.
Blood in the urine. Very good. So we got blood in the urine. Dysuria.
Not peeing normally.
Yep, not peeing normally. It's just not functioning correctly. And diuresis. Uresis. This one's a little bit more complicated. Di means like through, to pass through. And uresis is like urinating. So they are, it means like they're able to urinate well. Is it urinate through? To pass through? Let me type.
I found a definition, increased or excessive production of urine.
That would make sense. Yeah. Because so the di means through, right? And so a lot of it is coming through more than normal. And so a diuresis is you're urinating more than normal because more urine is passing through. And that's where the di comes in, because di means to pass through something. Diuresis. So a heavy flow of urine. So again, we're just breaking of those root words. And so when we come across these new words, like I was saying, we just need to start breaking them apart. And the more connections we can make, the more it'll connect into our brain and we're more likely to remember them. So these were our 3 groups of new words that we could kind of dissect and look at there. Just like last time, I do have some online quizzes here. This is the same one from last week. And then we have 2 others that are kind of just a fun way to get exposed to new words, to try to guess. And then if you get them wrong, they tell you what they mean. And you can go, oh, that's what that root means. I get it now. Let's look at our homework for this week. So let me go to week 9. We have 3 assignments. The first one's a vocabulary review, mainly from the old list from the week before. There's a few from the new ones that we talked about today. This is a Google form. For some reason, it's saying sign in. If you ladies have difficulties with this, if it's not letting you access it, I don't think you should have to sign into Google. It may ask you to sign into your Google Gmail account to get access to it. If you're having difficulties accessing this quiz, let me know. I created it myself. It shouldn't force you to log in. If it asks you to log in, try to log in and see if it works. If you have problems with it, let me know and I'll try to solve it. But this is I think there's like 30 questions, some multiple choice, some fill in the blank of all these different words. One of the first questions, like if I actually click on it here, one of the questions I ask is if you're using notes or not. And so that's totally your choice. So I'll ask for your name, the date, and then if you're using notes, I don't care either way if you want to use notes or not, but I did mark it there so I can kind of tell if you use notes or not. It is self-graded, so when you're finished and hit submit, it'll actually tell you if I did it correct, which I think I did. It'll tell you which ones you got correct and which ones you got wrong, that you can go back. If you want to take it more than once, you're welcome to. So maybe you could take it one with notes and one without notes, or the first one without notes and then the first one with notes, or however you want. This is just a tool for you to help you practice and learn these medical terms. So that is our first assignment. Our next one is an online quiz that I came across that's really fun. I took it. There is, I think, 30 different questions. A lot of them are terms that we've covered. A few of them, there will be things that we haven't covered. And it even says that. It says some of the terms we haven't talked about. So when you come across some that are new that we don't know, just note them down. Just note them down, write them down, and that's actually the assignment itself. The assignment is to, when you're taking the quiz, what are some of these new words that you weren't exposed to that you didn't know that are now new words that we learned? And just tell me about them. Tell me which ones you came across that you didn't know. And then our last one is our CNA vocabulary list. The activities for you to find 10 new words that you don't know. So what I did is I gave you a copy of basically the first page of each chapter in the CNA textbook. When you go to the CNA program, the textbook that they will give you has, I think, 56 chapters. Let me go to the first one. So this is not the entire CNA textbook, it's just the first page. So when you open up the CNA textbook, each chapter gives you a list of all the vocabulary words in blue. So these so chapter 11 is about growth and development. And these are all of those key vocabulary words you need to know about growth and development. And these are all the abbreviations that you need to know. And there are over 50 chapters. And so like chapter 12 is care of the older person. And here's different, like atrophy was one of the words that we looked at, the shrinking of muscles, right? And so go through this. A lot of these are words that we've talked about: paraplegia, hemiplegia. And then some are words that you should know that I didn't feel I needed to cover, like hazard or hazardous. Here are other medical terms. So each chapter, so I basically gave you the vocabulary word, antibiotic. I gave you the vocabulary for all the different chapters in the CNA textbook. So each page is the first page of each chapter. That's the only thing that it is. But this was to kind of show you what are the different topics you're going to be covering in the CNA program and how much you're expected to read. Because in a semester, you're going to cover, maybe it's 2 semesters, you're going to cover 56 chapters of medical stuff and medical terminology. And I don't know, Benita Banks is our CNA instructor. I don't know how quickly she goes through them, but she has to go pretty quickly, right? To get through 56 chapters in just, what, 16 weeks? I mean, you're looking at 3-4 chapters a week. So and that might be maybe a chapter per class period, or two chapters per class that she's covering through this material as quickly as possible. And that was the purpose of this class too, was for you ladies to just get an opportunity to kind of dive in to a lot of these terms, dive into the vocabulary, and start practicing a lot of these terms and abbreviations. Our next class, we're going to focus specifically on just the abbreviations that are used in the medical field, because we've done our 2 units over Latin and Greek root words. So we're going to move on to abbreviations. And so our homework for this week, like I said, is here are 3 of the PDF files of all the chapters. I didn't include the first 10. I actually started at chapter 11. So it's 11 through 56. And you can go through, and the assignment is just find 10 new words that you didn't know and see if you can break them apart if possible. That you might see some root words that you say, oh, I've never seen this word before, but I understand what it means because I can break it apart. Some of the words you can't do that with, that it's just a term you have to have memorized, like angina pectoralis. I know that angina means choking, pectoralis are your chest muscles. So angina pectoralis is that pain you experience before a heart attack. That'll be a term that you come across in this textbook. So you have to find 10 new words that you didn't know before. Does that sound fair?
Yeah.
Manageable? Because you have a week? Does that sound good? So this is, like I said, just to give you a heads up of what is coming when you take that CNA program, to kind of start diving in to some of those topics before. So that's the 3 assignments for this week. You have an online quiz that I created that is specifically just words that we've covered. We have the medical terminology quiz online. A lot of them are things we know, but like I said, just note down the ones that you didn't know, and the ones that are new that you learned. And then same thing, go through all of the CNA vocabulary, and again, find some of those new words that you didn't know and write them down. And then here's a copy of my slides from this week.